Health Secretary RFK Jr. and the federal officials he's appointed have been busy. So the first thing is that the administration announced really dramatic revisions to the set of vaccines recommended for American children as part of the routine immunization program. And what they did is they reduced the number of diseases covered by the program from 17 to 11. And this announcement is really a massive shift in federal vaccine policy, and it really circumvented the detailed evidence-based process that has underpinned recommendations in the past for decades. So to be clear, there is absolutely no new evidence suggesting that the vaccines that are being reduced are unsafe or ineffective. But RFK Jr. has long sought to reduce the number of vaccines American children receive, and he seems to be getting his way. And I just want to highlight, so one of the vaccines being reduced is RSV vaccine for babies. So RSV is a respiratory virus that's particularly dangerous for young babies. And its reduction comes just as more evidence drops about how good the vaccine is at reducing hospitalizations in babies. So, having these reductions in the vaccine schedule is going to matter, and it is going to lead to more sick children and babies. Also last week, the Department of Health and Human Services released new guidelines on alcohol consumption. So basically, they got rid of long-standing warnings on the risks of cancer from excessive alcohol drinking, and they removed clear drinking guidelines. And instead, all they say now is that people should consume less alcohol for better overall health and limit alcohol beverages, which is likely to be much less effective in providing people the information that they need to safely drink alcohol. And then there's the more quiet undermining of public health in America. So the US Preventative Services Task Force is an independent panel of experts, and what it does is it reviews evidence and it makes recommendations for what screenings, counselling and preventative medications people should receive. And so by law, most insurance plans have to cover those at no cost to the patients. So primary care physicians just rely on those recommendations in their daily practice, whether it's about screening advice or medications to reduce heart disease and so on. But basically, RFK Jr. has been undermining how that task force operates. So it hasn't met in person since March this year. So without citing any reason, RFK Jr. basically just postponed its July meeting and then also cancelled its November meeting because that was scheduled during the government shutdown. But the point is that neither of those meetings has been rescheduled, and there's no idea when that task force is next going to meet.